So, talking about bladder and bowel, what can you do about it? If you're somebody and you recognize that you're a person living with signs or symptoms of bladder or bowel dysfunction, which could be related to your multiple sclerosis diagnosis, what do you do now? Well, I think it's really important that firstly you know that you are not alone. There are very many people living with MS and living well with MS and symptoms of continence dysfunction, along with other symptoms of MS. This has been done by taking the first step often by talking about your personal experiences of your symptoms with your healthcare professionals. And that's with all your symptoms and experiences that you're having, including bladder and bowel. With regards to bladder and bowel, often conversations come up for many reasons. It could be because you have been hospitalised or people have been hospitalised due to urinary tract infection, or they're talking to the healthcare professional about how fatigued that they are and how poor their sleep is. And when you dig a little bit deeper, we find out that people have been getting up 9 times a night to go to the bathroom. Now, who wouldn't be fatigued after having to get up that many times overnight? And that there are those who just feel comfortable to speak up and talk about their troubles with their bladder and bowel patterns and habits during a consult. And it's important to remember it's actually part of the neurological assessment in MS of the EDSS, that questions about bladder and bowel are in that assessment. Early conversations about bladder and bowel symptoms can be very helpful, as there is a wealth of support, resources, services, and healthcare professionals who are passionate and available to help you with your questions and symptoms and to live well. There are also many tools available, some of them to start a conversation, some for a deeper dive and understanding on the topic. A good place to start is the Coloplast MS Bladder Check tool. This has 9 simple questions in a questionnaire with great graphics as well to help you identify any bladder symptoms that you may have. And it can also be used to track your symptoms over time. It is self-completed and easy to do. And then you can do it at home, or you can do it during a consult and taken to your appointment with your healthcare professional for further discussion and follow-up. There's also the booklet, Your Guide to Bladder and Bowel Wellness in MS, that was recently put together by MS nurses from around Australia and New Zealand with the support of Hollister as an educational tool and to encourage self-advocacy on this topic for people living with MS. Both resources can be found on the MS New Zealand website. There are also tools and information available further on bladder and bowel function in MS from MS New Zealand on their website, or from Continence New Zealand, and Continence Health Australia, including helpful tools such as the New Zealand Toilet Card and the Toilets New Zealand website to help people find where toilets are close to them when you're either travelling or in town. When you talk to your healthcare provider about bladder or bowel concerns, they may ask you to complete simple assessment tools like a bladder or bowel diary. They may also refer you to a specialist service for a more detailed continence assessment. A common first step is a renal bladder ultrasound. This could be done within the clinic, or you may be sent to a radiology department to have that done. And this checks how well your bladder is emptying and is there any retention happening. Once these initial assessments are done, your healthcare professional can decide on the next steps to take with you and to arrange any referrals. Depending on your symptoms, you may be seen by a urologist or a gastroenterologist to help with the management and the assessment of your concerns. As it is with MS, things can evolve over time, for better, for worse, or largely stay stable. So with the regular follow-ups with your healthcare professionals, we encourage you to keep them updated if anything has changed. Assessment may need to be repeated over time, a short time or a longer time, if your symptoms change. So again, please keep your healthcare professional in the loop and talk to them, and so we can keep up to date with what is happening with you. Having knowledge can be really empowering and provide you with some practical skills and understanding that can assist you with navigating bladder and bowel symptoms associated with MS. And so we really support self-advocacy in these ways. You are the true expert on you. We encourage you to take charge of your own health by seeking understanding of the underlying causes of your concerns and knowing that the possible treatment options are out there. This will allow you to take a proactive approach to maintaining control and confidence in your day-to-day life, and there are MS healthcare professionals there to assist you when you need.